First of all, could I ask you, when did you start losing your hair?
I'd say when I was about 23,
Okay.
I noticed that if it was, say, blow dry before filming, I'd noticed that it was just slightly going back.
Right.
And although I was in denial,
Okay.
it does run in the family. So
Okay. And what have you done about this?
I've tried various concoctions from the internet, sent off for this and that, and I've lost count of the different potions that I've tried.
Okay.
But I find them all a bit too time consuming, and it makes me feel a bit too vain messing about with them and trying to put these gels on my head. So on and off I've pretty much tried everything.
Right, okay. Now how has your hair loss affected you?
Well, because my job dictates that I'm on screen a lot. I see myself on the TV and you're your own worst critic, so I always see myself and I think, I'm just looking a lot older, and I just find that it ages you a lot. Because before I had quite a young face, but as soon as I started to recede, I just looked a lot older, and I started to lose a bit of confidence. And where I noticed it the worst, I had a car that was a convertible, and I drive along.
Okay.
And I pull up, and when I got out of the car, like a mad scientist with this tuft at the front and these big bits sticking out, and that's what I thought it was a mistake, actually.
Right. So would you admit that this has affected your career, your hair loss has affected?
Yeah, absolutely. I mean, everyone's got a shelf life, and when you're 37, I mean, you should really still be in business, but people start looking, maybe he's a bit old now, you've got the youngins coming through that have hair.
Okay.
And I don't care what anyone says, when your career is on the screen, you need to look young, healthy and vibrant, and if you're losing your hair, you don't, you look like you're aging.
Okay. So what are your expectations from this procedure today?
I want something that's subtle. I don't want to sort of go out there, and people say, oh, hang on a minute, he was losing his hair, now all of a sudden, he looks like Tom Berringer. I just, I want it to just sort of look like it's receded, maybe slightly, I just really want my hairline back.
Okay.
I want to be able to style my hair.
Okay.
My biggest problem really is messing about with it for the past few years. I've dyed it, I put some bleach in it, I get it coloured to try and thicken it up, and I mess about with it, but ultimately I always end up with this silly bit stuck up at the front, and at 37 years old, I feel a bit, I'm a father of two, and I feel a bit like, like a kid that hasn't grown up. I don't want to have to colour my hair, I just want to be able to style it some way or another.
Right. And what do you know about this procedure?
I've been looking at procedures for the past few years, but I felt that I haven't really advanced enough for me.
Okay.
I've seen all the horror stories, and I've seen the slicing at the back of the head and the stitching up and everything else.
Yeah.
So it was something that I've never really considered until I heard about this place and the fact that you can extract hairs and put them back in without knocking me out for a start. I don't really want surgery having a family.
Yeah.
But I've heard that it's something that's not really too invasive. So and the recovery time's quick. So that's really what got me interested.
Yeah. Have you got any concerns at all about this procedure?
Well, I've heard different stories about shock loss, and I've heard that you can reject the hair, etc., that sort of thing, but I don't know if that's all a thing of the past or...
I think your concerns are right. I mean, with any surgery, you would be expected to have some kind of shock loss.
Yes.
But I think with experience, we've seen that using a certain set of medications, we've literally negated shock loss. Literally, there's no shock loss whatsoever.
Right, excellent.
Because the tools we use are so tiny.
Yeah.
They're so minimally invasive.
Right,
We've literally ruled out shock loss.
Excellent.
Now, again, an advancement with this procedure is that it is a bit time consuming. You will be with us for about 6 to 8 hours.
Yeah.
We look to do about 2,000 hair.
I'd rather 8 hours here than every morning sticking potions on my head and not seeing any hair.
Okay. There's literally no chance of rejection. We've had, with experience, we've done so many procedures and we've never seen a failure, touch wood.
Really?
Now, we do expect a bit of vigilance on your part for the next couple of days.
Yes.
You ought to be careful.
Yes.
In the sense that we'll give you a spray. You need to be spraying every 30 minutes whilst you're awake for the next 3 days.
What does that do?
It's just a saline spray. It's like water. Now, washing your hands is better than not washing at all.
Right.
It's like a mechanical disinfectant.
Right, I see. Yeah.
Spray.
Yeah.
And it stops you from getting any infections.
Right.
It keeps your area nice and clean and makes sure your hair grows through.
Okay.
Your skin is moisturized.
Yeah. Yeah.
And try not to touch and pick your head for the first 4 days.
Right, okay.
After 4 days, the grafts are taken up, you should be fine.
Yeah.
If you look after the hair for the first 4 days, they'll stay for the rest of your life.
That's an amazing recovery time in 4 days.
Yeah. In fact, by 48 hours, no one should notice that you've had anything done in the front.
Really?
The back will take about 3 to 4 days. We'd suggest you start washing the back of your head.
Yeah.
From tomorrow.
Yeah.
So
you can be a little bit more rough with that because you've just taken, you're not putting anything back.
Precisely.
Yeah.
Precisely.
Excellent.
Yeah. Now the way I plan my surgery is that I always plan it 10 years ahead. I can literally go in and do...
So I've got booked 10 years in advance?
Well, I think when you do any cosmetic surgery, you need to take into account what happens in the next 10 years.
Yeah.
So the way I plan is I always go fairly conservatively, so that if you lose more hair, God forbid in the next 10 years, we will still be having enough hair to do another procedure.
Looking at the bigger picture.
Precisely.
Excellent.
Precisely. We do expect further advancements in this field.
Yes.
But even if nothing happens, in 10 years' time, we'll have enough hair for you to cover the rest of your loss.
Yeah.
That's the way any cosmetic surgery should be planned.
Right. So I suppose if you didn't make them considerations and you lost some more hair and you were taking too much out, you wouldn't be able to infill that gap.
Precisely.
Right.
Precisely. You can't. People claim to use body hair, but it's of a different nature.
Right.
The only other hair we can use is your beard hair.
And that's really rough.
Precisely.
Yeah.
Precisely. You will see some scarring on your face, which you don't want.
No.
The last thing you want is an island in the front and nothing in the back.
Yeah.
So that'll So that's the way we plan any cosmetic surgery.
Brilliant.
Complications wise, touch wood, we've never seen any infections. We do give you a course of mild antibiotics, just to be on the safer side.
Right.
We also give you a mild steroid for about 2 days to make sure you don't develop any swelling on your face.
Brilliant.
Pain wise, I've never seen anyone complain of pain. We do give you some paracetamols. If you have pain, you can take them. I've never seen anyone complain of pain after.
So I can resume normal duties pretty much straight away?
You can go back to work tomorrow.
Brilliant. I wanted a week off. That's good.
If you're doing weight training, we'd suggest at least a week to 10 days.
Right. I suppose
you will be straining
on.
precisely, and you'll be using the facial muscle as well.
Right.
That's the only thing we'd advise from you.
Okay.
If you're swimming in a pool, at least a couple of months, or in a week's time, you can start wearing a cap and swim.
Is that because of chemicals?
Precisely. The chloride content is so high.
Right.
If you're going to a sea, you can swim literally in a couple of days' time.
Really?
No problem at all.
Brilliant.
Yeah. Washing instructions, we'd expect you to just keep spraying for 4 days.
Yeah.
After 4 days, we'd recommend you start washing. We provide you with a shampoo.
Right.
We'd recommend you wash your hair with that shampoo after 4 days.
Okay.
Any other questions?
Yeah, so with this procedure, I know that it's a grafts and you do it on so many grafts a day, and I remember you mentioning that you can do so many grafts a day. How many grafts do you think I would need to bring my hairline back just by looking at it, from your experience?
From my experience, you need anywhere between 800 to 1,000 grafts to give you very good density.
Right, is that on each side or is that for the...
Altogether.
Altogether, oh, that's not... So you'll only take 800 to 1,000 from the back there?
Precisely.
Okay, and I've noticed when some people go bald, they lose their hair and they carry on going bald down here.
Yeah.
So what, do you take it lower than where they go bald?
Precisely. Now, there's something called a permanent zone at the back.
Yeah.
Which are testosterone resistant. That means you'll always have these hair.
Right, I see.
The way I do is I draw a line from the top of your ears.
Yeah.
And there's a bulge at the bottom of your head.
Right.
If you feel there's a bulge right just above your neck, that's called the permanent zone.
Right.
That's what I use. Now, again, one of the significant advantages of this procedure is that you can have a grade 1. You can shave grade 1 and no one should notice.
Right.
Now, to achieve that, I always space in such a way that you leave enough gaps in between.
So I can have this hair cut this short again after the transplant, and you won't see it? No scars?
No.
That's incredible.
Yeah.
It's incredible. So a procedure for me, you bring me back a hairline.
Precisely.
Would you do anything here where it's thinning, or?
I wouldn't touch your crown for now.
No.
For your crown, I'd suggest you to start taking some medication.
Right. Okay.
You could. I mean, if you're okay with Propecia, you can continue using Propecia.
Right. Okay.
You will see a lot of your hair will grow back.
Yeah.
Worst case scenario, your hair will stay, you won't have any further loss.
Right, right.
And I'd recommend to start using minoxidil
Okay.
as well. Now there is some convincing evidence which says that a new kind of laser does help stabilize your hair loss and thicken your own hair.
Yeah.
I would definitely recommend that.
Right.
What the recommendation we give is there's a protocol. After 4 weeks, we'd invite you to come over. For the first 3 months, we'd recommend once a week, 15 minutes.
Okay.
But if you're busy, you can come once in a fortnight, sit
right.
and read for 30 minutes.
Yeah, yeah. That's a lot less hassle than having to stick something on your head every day, isn't it? Yeah.
Precisely.
Or wear a hat.
Yeah.
Or try and style a little tuft at the front, you know. Yeah. That's brilliant.
Yeah. Any other questions?
No, when can we start?
We can start straight away. Should be an
Brilliant.
issue. Yeah.
Brilliant.
Okay.
That's
Thanks,
great.
Ron. Thank you.
Thank you.
Thank you.